evening. I am your host, Jennifer Jones. Welcome to Medical Mondays. Today's topic is updates on COVID-19. As Dr. O tag teams with Dr. David Ajibade, and she is going to come with us now to introduce their topic for the evening. Dr. O.
Thank you so much, and welcome to Medical Mondays. We're just going to take it from here. Or Jennifer, I'll give it back to you.
Absolutely. Thank you so much, Dr. O. Good evening and welcome to each of you for choosing to make health and wellness a priority for our community. Medical Mondays exists to provide information to empower you to be healthy by living a prevention-centric lifestyle. From choosing nutritious foods, sleeping, exercising, and taking care of your body and mind to have access to the highest quality healthcare practitioners, healthcare professionals, and health experts that all contribute to you living your best life. Thank you, audience, for joining Medical Mondays with Dr. Toyin Opisami, MD, and American Academy of HIV Medicine expert for an exciting conversation about our health. Medical Mondays introduces health information, medical facts, and possible solutions as we examine health challenges to enable each one of us to live our best life. Whether providing high quality care for families and individuals through Genesaret Medical Center, providing care for vulnerable communities through Global Vision Health Center, or providing medical missions in the US or abroad, Dr. Opisami is committed to changing lives through healthcare wherever she goes, one person, one family, and one community at a time. Medical Mondays provides an opportunity to explore healthcare with one of our nation's leading community health advocates and world-renowned medical missions expert, Dr. O. Audience, if you have questions as you listen to Dr. O and our Medical Mondays guests, please drop them in the chat box or raise your hand and you'll be recognized to ask your questions. Now grab your pen and paper, lean in, and get ready for an exciting conversation about our health. Dr. O, the floor is yours.
Thank you so much again. Well, I will be dialoguing together with Dr. David Ajibade tonight on updates regarding COVID-19. As we know, just to refresh our memories, COVID-19 is coronavirus. And because we identified it in 2019, it's COVID-19 that we're dealing with presently. But before I go on, I just want to thank everybody that is here tonight. A lot of people are out of power in the state of Maryland. We have a storm, and I was talking to somebody on the phone, actually my accountant, and electricity went out. We also have a very key person who has never missed any of Medical Mondays, presently now in the emergency room. So much is going on, but for every single thing, we glorify God. I also want to say that we are not establishing care by the presentations we give here and the dialogue we have. This forum is about empowering you, strengthening you by giving you medical facts and giving you the opportunity to ask questions that we will answer as experts in the field free of charge. So, COVID-19, what a year and a half we have had. Coronavirus has been here forever. If you look at Dettol bottle, you will see that it says Dettol kills coronavirus. People from Nigeria, look at the Dettol bottle. Some people call it Dettol, some say Dettol. It's been there because it's been there forever. But like every virus or any virus, it mutated. This was not the first time it mutated. It mutated, a few years ago in Asia. And at first, we called it SARS, severe acute respiratory syndrome, that occurred in Asia. And because it was in Asia, it wasn't here, I don't think we paid too much attention. Then we had the MERS, also in Asia. And because again, it was in a pandemic, we didn't give it much thought. Thank you for President Obama. He actually set up something in the White House to address possible epidemics and pandemics, but unfortunately, that was dismantled. Hopefully, the new, not hopefully, they're working on it now, and we have something in place, for future viruses. Coming back to coronavirus, it has devastated the whole world. A lot of people have died, the statistics. I'm not here to give you statistics tonight. I'm here to give you update. So, vaccines were produced in order to curb the virus. What do vaccines do? Vaccines emulate the virus in the body and cause the body to think that it's been exposed to the virus, and so produce antibodies, which are soldiers that protect and fight against the virus in the body. That's basically what vaccines do. The Pfizer and Moderna vaccine are the first mRNA vaccines we've ever had. And then we have the Johnson & Johnson, also, that is not mRNA, from DNA. But that being said, those are the three we have here in the US for now. And a lot of people have been immunized. As a result, we've had some stability. Yesterday, Maryland recorded 0 infections for the first time in this pandemic. And our governor in Maryland has decided that come July 1st, you can go out without mask, you can just start living. However, word of caution, we have the Delta virus, the Delta coronavirus from India. Not very long ago, we had 6% of people infected with coronavirus in the US having been infected with the Delta virus. It is extremely virulent, much more transmissible than the original virus we had, even more transmissible than the UK strain that has taken over the United States now. From the 6%, the statistics we had back on Saturday is that 9.9%, about 10% of people have been infected with the Delta virus. So we need to be careful. There's good news though. The mRNA vaccines we have right now, if you get one vaccine, one shot, the first one, it protects you 33% against the Delta virus. If you get the second vaccine, the second dose, it protects you 88%, which is great, but that's still 12% chance that you can still get the virus even after getting vaccinated. So we still need to be cautious. The places that have opened on July 1st, what do we do with it? When I said we should be cautious, but our governor, our leaders are saying that it's okay to now go out without mask and to start living. I think we'll discuss that further during the Q&A. There's something else, something brand new. The UK did a study. The study is still very much hot, preprint right now. In fact, most, I would say maybe over 90% of the medical personnel, maybe more, don't even know about what I'm going to tell you. They did a study where about 394 people had MRI done pre-COVID, and a good percentage of those then got COVID. So they repeated the MRI on both sets. And guess what they found? That people who have had COVID lost in brain matter. And they compared those who had mild disease compared to those who needed hospitalization and were hospitalized, and found that there's no difference. There is still loss in brain matter. How significant that is, we don't know. This was supposed to be peer reviewed, but then we got Juneteenth. We got Juneteenth as a federal holiday. And so they had to postpone to this week. It's so urgent that they're doing the peer review right away. Again, we don't know the significance of this loss of brain matter. That has to be followed. So what am I trying to say? It's better to prevent getting coronavirus than to take a chance. Because none of us know the full extent of this virus yet. And none of us know the full extent of the vaccine, the mRNA vaccine, because it's never been used, it's never been done. And if you're interested in me going in further into how it is done, and all, we can do that in the Q&A. My message today is that we still need to be careful. And it's better not to contract the virus than to contract it. So I'm going to yield to Dr. Ajibade, because I don't want to take too much time. I just want to give you quick update. And I want to give time for question and answers. Dr. David Ajibade.
Hello, Dr. O. Good evening.
Good evening.
Thank you for having me. Good evening, everyone, and hope everybody is staying safe. Thank you for that introduction, Dr. O. Yes, about the great news about coronavirus, great news about the fact that it's been under control, especially in the United States and around the world. For sure, the mRNA virus and the others like it have surely proven to be effective. So we're very grateful about that. Now, that is very scary about the gray matter loss in the brain. I've told people over and over again that this virus is a gangster. That's the only way to describe it, because of the kind of number of things that it does to the human body and how it affects the human body. So I'm just going to be saying a few things about the other things that you can do to keep yourself healthy. Yes, you get the vaccine, but understand that the vaccine is not the be-all, end-all of the situation. For instance, the vaccine is only specific towards the coronavirus. And yes, to some degree, it protects against the variants, as Dr. O has said, but we cannot leave it there. We cannot leave everything. And that's a mistake I see people making all the time. It's like, okay, we have a vaccine now, we can drop our guard and do whatever we want as long as we've taken the vaccine. That is not so. And I remember I was speaking in Nigeria at the National Broadcasting Commission, their annual event. And I said, this is not the first pandemic. It's not going to be the last pandemic. There will always be viruses. There will always be bacteria. And once in a while, a superbug is going to appear that's going to take all of us unawares. But in the final analysis, the one thing that you can do, and that's what the Medical Monday is about, is that you can do what it takes to strengthen your body, specifically your immune system. And we talk about this a lot In my opinion, this should be the foundation and the groundwork of everything that we do where our health is concerned, because your immune system is what protects you against all kinds of bugs and bacteria. But in addition to that, cancer, even cardiovascular disease, if your immune system is working well, cardiovascular disease too will be protected against. So I just want to say a few things, and then I'll yield to Dr. O, yield back to Dr. O. There are three, let me put it this way. I'm going to talk about the three nutrients that will strengthen your immune system. Notice I don't use the word boost, because boosting may not be in your best interest. And COVID-19 has taught us this. Many cases in which COVID-19 was so severe in patients, and that even caused death, it was because the immune system was overreacting. It was not just the virus that was causing the damage, it was what the virus triggered in the immune system. So the immune system went haywire and started attacking the blood vessels, the kidneys, the heart, and yes, even the brain. And that's where the challenge was. So you don't necessarily want to boost your immune system, but you want to strengthen your immune system. So your immune system will be intelligent enough to take charge and reduce and not go overboard when it's trying to protect itself. So I'm going to leave you with three main nutrients, which we have heard about over and over again, but we cannot overemphasize them. One is vitamin C. The thing about vitamin C is that vitamin C helps to protect the mucous layers, which are in the nose, the mouth, and other parts of the body. That is your first barrier and defense against infection. Vitamin C also stimulates the immune system and helps the immune system to mount guard and to fight off the infections. Vitamin C does a lot of other things as well, but I'll stop at that. Vitamin D2 is super important in many of the cases, or if not most of the cases, and by that I mean 95 to 98% of the cases of severe COVID-19, they found those people to be very deficient in vitamin D. Vitamin D, what vitamin D does is that it helps to modulate and temper the immune system so that the immune system doesn't go haywire, as we had earlier said. And number three is zinc. Zinc is very important in that it helps to stop the replication of the virus. There was a lot of shout about hydroxyurea, and there was a lot of controversy. I'm not going to wade into that, but not hydroxyurea, I'm thinking about sickle cell disease. I meant hydroxychloroquine. What hydroxychloroquine does is that it opens the door for the zinc to enter into the cell and kill the virus, or to stop the replication of the virus. It is not the hydroxychloroquine that's actually doing the work, it's the zinc that's doing the work. So you need those three. Now, in addition to that, and I think I may have mentioned this the first time I spoke, in addition to that, remember that 70 to 80% of your immune system rests in your digestive system, in your gut, in your colon especially. Therefore, it means that the health of your digestive system is absolutely key to the health of your immune system. What does that mean? It means you cannot be putting junk in your body and be thinking that your immune system is going to work like it should. Because 80% of your immune system is in your body, is in your gut, in your digestive system. So it's very important that you still stay primed, you still stay on guard, you still take your healthy stuff, the fruits and vegetables, dial back on the alcohol, dial back on the smoking, dial back on the excessive junk food and the preservatives and all the other processed foods that you've been warned about. You know better. So you want to dial back on those things, because those things specifically affect your guts, and they affect your gut adversely. In addition, you need to take a lot of fiber, because the fiber feeds the good bacteria, which in turn help to feed the immune system. One more thing I'll say before I hand back to Dr. O, your dentition, your teeth. Your teeth. I love Dr. O's, look at Dr. O's dentition. Look at how white and fresh, and this. It's the same thing with Jennifer Jones. I'm Dr. Jennifer. You guys all have beautiful teeth. Please, it's so important. There's a lot of data coming out now about the importance, the relationship between the health of your teeth and your gums and your immune system and your cardiovascular system. A lot. So you want to make sure that you're flossing regularly, you're brushing your teeth before you go to bed. And of course, as they recommend, 6 to 12 months. The standard is 6 months, you go and do your medical checkup, your dental checkup. In Nigeria and other parts of the country, parts of the world, they may not be able to do that, but in the US, you have better access to that. So please take advantage of those things. They are super important. They may not seem so, but they are super important. Thank you, Dr. O. Let me hand it back over to you.
Thank you very much, Dr. Ajibade. That was awesome. You know, this forum is all about prevention. You guys who were here from the first episode, remember me saying that we do better preventing in medicine today than treating. We prevent so many things, or we can potentially prevent so many things, but then it takes partnership between physicians and patients. We have to do a lot to protect ourselves, to prevent illnesses, and coronavirus is one of them. We really can do better with our immune systems, like Dr. Ajibade said. And I just want to add that vitamin D actually has been shown to help block the virus. So vitamin D with zinc, our pulmonologists, advocated that and still advocated that we should add that to vitamin C. And if you are not sleeping well, melatonin also, we should add melatonin to the regimen and aspirin.
Dr. O and Dr. Ajibade, I want to commend both of you on an absolutely exceptional update. I placed in the chat box what I think I heard, and I'm going to have us continue to repeat it despite the fact that we are vaccinated and the emergency orders are being lifted. We need to still proceed as if the virus is a threat. Continue social distancing, continue wearing our masks, continue drinking water, continue eating healthy, continue being vigilant, is what I think I heard you say, Dr. O. The brain matter issue is frightening. We're waiting for the results and outcomes, but is that what I heard you say, Dr. O? Stay vigilant.
That is correct. Stay vigilant. No matter what your state dictates, no matter what CDC even says. On that point, I want to note that a lot of people have been upset about CDC saying that, they said that you should wear one mask, then they said 2 masks, and then they come up with this suggestion this week, and next week they change. CDC has been doing awesomely well. Medicine changes. We change as we learn more. We change as we research and results come in. And CDC has been on top of this. Researching, implementing, putting different things in place so that we can learn more about this virus, and immediately educating us as citizens so that we can benefit from protection. We've got to remember that God gives us knowledge in minuscule forms, and we utilize what we have. You cannot give what you don't have. The only thing that does not change is the word of God. The Bible does not change. It's alive. It breathes, it lives, but science changes. What I'm telling you today, come next month, I may come again with another COVID-19 update. Guess what? This brain matter issue, I'm going to come back to update you. We don't even know much about it yet. We don't know what the significance is of this loss. So we're going to keep updating as we learn. And so for people who have been discouraged about the changes and regulations and all, it is for our own good. Those changes are brought as more knowledge is bestowed.
Beautifully said, Dr. O. Dr. Maya Angelou has a famous quote that she says, when you know better, you do better. And so that's what you're saying. When we know better, you will
We
come back
do
and
better.
update
That's
us.
right.
Yes, Auntie. And you know, I know you. You make sure that we know better. She's a woman who makes sure in anything she touches that you know better so you can do better.
Absolutely. And Dr. Ajibade, you did an excellent job. And we have a couple of questions in the chat for both of you. You did an excellent job of sharing with us and reminding us how important our gut, what we put into our bodies, what we eat, what we drink, and even for the smokers, we need to stop all behavior that really puts at risk our best chance to fight against the virus. Dr. O and you both have shared that coronavirus is with us and future virus and pandemics may be before us. And so the best thing that we can do is first go for vitamin C, D, zinc, and Dr. O added melatonin to complement you if you're not getting enough sleep and rest and restoration. So with knowing that and with healthy eating, Dr. Ajibade, what do you want people, everyone is concerned in the chat about finding the right vitamin C, the right vitamin D, where they can find it. Someone even said that at Costco, they've been told that the vitamin D that's sold on the shelf at Costco is not good. Someone else has raised the issue of too much vitamin D is toxic. So what dose should they be taking? And others have asked, is there an equivalent in taking vaccine versus prophylaxis? So let's just deal with the vitamin D and zinc first, and the vitamin C. What doses should people be looking towards?
Great question. I generally recommend, unless you are out in the sun every day for about an hour at the very least, if you're dark like I am, maybe not as, even if you're light the way Dr. Jennifer is, I would strongly recommend that you take nothing less than 5,000 international units a day. Let me tell you this, folks, the risk of toxicity of vitamin D3 now, if you take D2, you're on your own. D3 is the more important one and it's a healthier one. The risk of toxicity of D3 is really, really low. I mean, you would have to take you would have to be taking like, what they say is like 60,000 international units a day for a long period of time for you to really be toxic. And I believe the upper limit is about 150 nanograms per mil, nanograms per mil. That's when you're talking about toxicity. Now, the average they recommend you should be, the safe zone is between 30 and 100, 30 nanograms per mil to about 100, but it can go as high as 150 without any adverse effects. So I would rather have too much vitamin D and get COVID-19 than too little vitamin D and get COVID-19. I mean, it just makes sense that you don't want to be caught with your, as they say, pants down. Forgive my French, but you don't want that. You want to have enough vitamin D, especially as a Black person. I cannot overemphasize that. Black people have low vitamin D. In every test, they have seen that Black people have relatively lower vitamin D levels because of our dark skin. So it's very important. Now, in terms of what specific supplements to use, we cannot give you specific names because of the platform, unless, of course, we're given permission. But you can contact us afterwards, and then we can definitely point you in the right direction. There are some, as in all cases, there are the good, the bad, and the ugly out there. So you want to be pointed to the right ones. What was the other question you had, Dr. Jones?
And so the next question was, someone asked about, go right ahead. Absolutely, Dr. O, because I thought you would want to talk about the vitamin D.
Yes, thank you. I appreciate that. So Dr. Ajibade is correct. However, in the United States, we have the opportunity to test, and we have access to excellent health. Excellent health facilities, healthcare facilities. Vitamin D is one of the fat-soluble vitamins. See, as opposed to vitamin C, that is water soluble. You can take as much as you want of vitamin C and you will urinate it out. You pee it out. Vitamin D, on the other hand, A, D, E, K. Those 4 vitamins are fat soluble. So the potential for toxicity is there. So in the United States, we actually monitor every 3 months. When we put you on vitamin D, we monitor you. I, in my practice, actually screen for vitamin D deficiency. And once I screen, if you're deficient, I will start you on a dose with relation to your deficiency and then continue to follow. So while, I agree with Dr. Ajibade, I am a little bit leery about the sun too. Look at how dark I am. Do you know I got sunburnt one time in my life? And I was over 50 when this happened. I got sunburned in Phuket, Thailand. I had a blast with my husband in the sun every day, no sunscreen, sometimes just had a wrap around me, tied on the shoulder, was at the beach, or at the pool every day. And I got back and I was peeling in my face. I actually got sunburned, my shoulders and all. So I called my friends and I'm like, wait a minute, I'm Black. How did I get sunburned? They all started laughing at me. These are all physicians, and said, don't you know that even as a Black person, you need to wear sunscreen? That you can get sunburned? So I lived in Nigeria. I never got sunburned. I played netball. I was a relay race runner. I did 100-yard dash. I was in the sun all the time. I never got burnt. That being said, we are dark skinned because of melanin in our bodies. The melanin protects and shields us from the sun. So I see people from Africa who are vitamin D deficient, and it blows my mind that why? Because it's very hot there. The Lord gave us this beautiful skin that don't wrinkle. So you're 100 years old and you look like you are 60 something because of melanin. So we are shielded. We're protected from getting skin cancers as much as our Caucasian counterparts. So as we advocate that Caucasians should put on sunscreen, we're now advocating that African Americans, Black people, generally should put on sunscreen. And that shields you from vitamin D. My suggestion, take the supplement. There are foods though that are rich in vitamin D. Mackerel, tuna, salmon. How much should you eat to get enough? How much would you eat to get enough? Maybe truckloads, I don't know. But I don't know anybody who has been able to bring up their vitamin D level through diet, through food. Please, if you know, let me know. I'd like to know. So taking vitamin D is very important. And if you're in the US, work with your physician to do that.
Thank you so much, Dr. O. One of the follow-up questions while we have you, Dr. O, and then I'll come back regarding the vaccine for both of you, was with what is melatonin, and can melatonin be taken in combination with Unison sleeping tablets?
Excellent question. Melatonin is a natural product in the body that causes us to sleep. The reason we sleep at all is because we have melatonin in our system. So it's over the counter, formulated into pill form. It would have, other things in there to make it into the pill form. What's the other question?
The follow-up to that was, can you combine melatonin with Unison? And it sounds to me like if you're taking melatonin, you might not need Unison.
Thank you. Thank you. You answered the question. If you're taking melatonin, you may not need Unison. I will not combine them. I'll say try melatonin, try, starting at 5 milligrams. You can go up to 20 milligrams. The max dose is 20 milligrams, and see what works for you. Some people start with 3 milligrams and say, oh, I can't sleep, it's not working. Increase the dose. You can start at 3 milligrams too. Then increase the dose to see what dose works for you.
That's beautiful, Dr. O and Dr. Ajibade, because I can tell you when I was caring for my mother a few years ago when she was recovering from a stroke, and she recovered, she's fit and thin and thriving. And her vitamin D pill, now she's 90 now, but her vitamin D was 50 milligrams a month. They gave her one tablet every month. And so I appreciate you so much for underscoring that it would take for you to be taking enormously high amounts of vitamin D to move into some toxicity or risk. And that vitamin C will be eliminated from our body. So there's no risk in taking those two vitamins. There's another question regarding the vaccine. Someone wants to know if these prophylaxis for vitamin C, D, zinc, and melatonin should be considered, or what's the equivalent between them and actually getting vaccinated. And then if you're vaccinated, does it prevent you from death?
Okay, I believe, first of all, the recommendations on what we've talked about, the vitamin C, D, and zinc, is to boost the immune system, as Dr. Ajibade, beautifully educated us on. Not boost, to, he corrected, or he said, don't boost your immune system, but it's to strengthen, correct?
Yes.
Your immune system. So we need, a robust immune system to fight any infection, including coronavirus. So that's the purpose of those supplements. The vaccine, we know, protects against coronavirus 90% of the time, at least for Moderna and Pfizer, 94%, I think, for Moderna, actually. And J&J a little bit, less. That number varies. I think 70 something in the US. But the vaccines are protective. If you get the vaccine and you contract coronavirus, which is still possible, remember, none of these vaccines are 100% protective. So you still have that, percentage of time that one can contract coronavirus. If you do, can you die from coronavirus? Well, that's a difficult one to answer. I would answer it that you definitely will not get as sick as you would have been if you didn't have the vaccine, because hopefully you have some antibodies against coronavirus. The reason why I cannot answer that question directly is because in the US, we give vaccines, but we don't check to see if you actually develop antibodies or enough antibodies to say you are totally immune. My husband got coronavirus vaccine in the UAE, and there they actually test to see if your body mounted enough immunity. And after his second dose, 2 weeks after, it was found that he didn't mount enough immunity, or immunity as they expected. So they gave him a third dose to make sure that it does. We don't do that. So is it possible that people who get the vaccine in the US and end up still getting coronavirus fall into the category of people like my husband, who after the second dose didn't actually mount enough antibodies to protect him? And so they were able to contract coronavirus. Is that possible? Yes, it's a possibility, because we are not testing to see if people actually have antibodies, or how much they have, or if they have enough. Is it possible that somebody may contract the Delta virus, for instance, and still have that high risk of dying from coronavirus? It is possible. It's a difficult one. What I will suggest is that we look at ourselves, and if we have any of the comorbidities, that is, any of these other things that I'll mention that can cause somebody to actually die if they get coronavirus, then we need to work on those as preventive measures. Obesity is one. Smoking, diabetes, high blood pressure. I mean, controlling these things. If you have them, you have to control them. The diabetes, high blood pressure. You know, people who have cancer on chemo. Look, if you have to be in your house and don't go out and be a hermit, be that until we get a good handle of this and not get exposed. So if you have any disease entities that affects the immune system, then protect yourself. So you're not in areas where you can expose yourself to coronavirus, even after getting vaccinated.
Thank you, Dr.
That's an excellent question.
Thank you, Dr. O and Dr. Ajibade. I have two quick questions that I want to make sure we talk about in this update. One is there are a number of people seem to be experiencing mental health anxiety and other challenges now that COVID is quote unquote over. And equally, people are starting to experience what seems kind of like a post-traumatic experience about going back out and being in society. And coupled with that is the concern that parents are having for their children as we look to the fall for them to return to school and for the college students to go back into the classroom. What are your thoughts about these mental health anxieties and grave concerns that so many are having? Dr. Ajibade.
Okay. I wasn't sure if you wanted to go first, Dr. O. Yes, those are big problems. And as a matter of fact, I think the statistics are scary. 30% and above, they're saying have some kind of mental health challenge amongst those who have actually had the COVID-19. Some of them, they call them the long haulers. Terms like brain fog are beginning to show up in many clinics of patients who maybe they just had a mild COVID-19 attack. Maybe the loss of smell, a little malaise, fatigue, fever, and they were okay. And then weeks afterwards, you would see them come back to the clinic with some terrible symptoms, including severe fatigue, sensitivity, numbness, brain fog, inability to remember words and names. I mean, it is just ridiculous what we're hearing about. And of course, Dr. O mentioned the loss of gray matter. So we are dealing with, this is really uncharted territory, not to mention the high rates of anxiety and depression and PTSD and all those things. So in such conditions, and this is where not just the healthcare professionals need to be equipped, but also the general public. So there are, and the way I think about it is what is it going to take to strengthen the brain? We talked about the immune system. I think we also need to start thinking about strengthening the brain. There are now nutrients, scientifically proven nutrients and nutraceuticals designed by well-respected scientists and doctors that are targeting brain function and brain structure that will help to strengthen the brain. A typical example, of course, are the omega-3 fatty acids. And I have to say this, that 90% of the omega-3 fatty acids, with all due respect, in health food stores are not up to snuff because there's a lot involved in purifying omega-3 fatty acids and making them bioavailable for the body. So there are some really good ones that will help. And don't forget, 60% of your brain is actually made up of fat. And that fat, a large percentage of that fat is made of omega-3. So if you are strengthening your brain, you cannot not talk about strengthening using omega-3s. Obviously, there are habits, and I'm going to say talk about a few more nutrients but there are habits and practices that are very important. Dr. O mentioned the Bible, your religion, depending on your religion, your religious practices, spending more time in things like meditation, things like silent repose, contemplation. These are things that help to calm your brain down and help to strengthen that inner man, so to speak, that inner part of your who you are, which in turn helps to strengthen your brain. Exercise, of course, is very important. Sleep. The reason we didn't say this, Doctor, but the reason why sleep is so important is that sleep is when your brain and the rest of your body get the chance to repair themselves. So the deeper your sleep is, the more restful your sleep is, and the more qualitative your sleep is, the greater the chance you have of recovering. And I still want to emphasize again that fiber, please, fiber. Now there are good quality fiber supplements. I take one almost every day. The flakes, not the tablets, not the powder, but the flakes. And you're all familiar with the one that starts with M that is in most stores. I don't even recommend that. There are more natural, more organic forms of fiber supplements that will do extremely well, especially if you take them at night, in helping to heal your digestive system and helping even to help in brain function and improving your brain structure as well. So fiber, you cannot overstate the importance of fiber. I know I'm throwing a lot of things out at you, but please, the antidote to depression and anxiety, in addition to going to a counselor, is rebuilding your brain and giving your brain the right nutrients. I'll stop at this point so Dr. O can say a few things.
That was absolutely beautiful. And you're not throwing too much at us. I'm trying to recap some things in the chat box, but this is excellent. This is exactly what we needed. Dr. O?
I 100% agree. Dr. Ajibade has answered that question very, very beautifully. But if you will please put your contact in the chat box, that would be great, so that people can contact you on these supplements and all of that. I just want to say that strengthening the immune system overall is very important, and sleep is very important. In fact, Dr. Ajibade is working on sickle cell disease, utilizing the immune system to prevent crisis and deaths in sickle cell patients. Can you believe it? A genetic problem. So our immune system is very, very important. If, for instance, if you have somebody with sickle cell and all, please contact him. Put your contact, please, in the chat box so that people can easily contact you.
Dr. O, we are going to now ask you for your medical moments. Right after we hear from Dr. Ajibade, any closing comments that he has for our audience.
Thank you, Dr. Jones. Your health is in your hands. Please take responsibility, take control of your health. We shall all get through this and we shall be stronger at the other end. So stay safe. God bless. Thank you.
Thank you so much, Dr. Ajibade. Dr. O?
Prevention, prevention, prevention. Strong health, strong future. And please stay put as we go into the after hour. And there's still so much I want to talk to you about. Thank you.
Thank you so much. Thank you, Dr. O. Thank you, Dr. Ajibade, and thank you to each one of you, tonight's participants. As we continue our mission to educate, inspire, and empower you and give you medical information and more that includes fitness, nutrition, health, wellness, lifestyle boosts, and as you've heard, joy, peace, meditation, recommendations for your soul. Please share the Medical Mondays link and invite your friends, family, faith-based organizations, nonprofit organizations, and community groups to join us, as well as individuals that you meet. Email us if you have any questions or need additional information at medicalmondaysdro@gmail.com. That's medicalmondaysdro@gmail.com. In addition, please subscribe to our Medical Mondays channel on YouTube and be sure to hit the notification bell on the page. You'll be notified for future shows and can join us with one click of a button. And most importantly, as Dr. O just said, strong health, strong future is our mantra. So hashtag it, strong health, strong future on social media. Share the link on Twitter, Facebook, Instagram, and TikTok. We look forward to our next conversation with you on Medical Mondays at 7 p.m. This concludes tonight's edition of Medical Mondays. Thank you and good night.